I think no matter whether you have night sweats or insomnia or any of the other symptoms that go with it, there's definitely a decrease in our ability and want to multitask and do and be everything to everyone.
Welcome to the Redefining Midlife podcast. I'm Jo Clark and I'm so glad you're here. And this is a podcast for women who are ready to break free from outdated stereotypes, rediscover themselves, and embrace the endless opportunities that midlife brings. Each week, I'll share expert advice, actionable strategies, and inspiring conversations with incredible women who are redefining what it means to thrive in midlife and beyond. From health and wellness to reigniting your purpose and passions, this is your go-to podcast for feeling empowered, supported, and seen. And midlife isn't the end. It's your time to shine, rewrite your story, and create a life that you truly love. So let's get started. Welcome back to episode 160 of the podcast. Now, this week I'm bringing back Dr. Sian Hebron, who is our regular and very special specialist GP. And she is our go-to on all things menopause and women's health. So it's great to have you back with us, Sian.
Thank you very much, Jo. 160 episodes. Well done, you.
Yes. That's a lot of talking over a lot of episodes.
That's wonderful. And they're such good episodes too. But us women, we learn a lot from you, Jo.
Oh, thank you. And we learn a lot when we've got you on as well, because you are, as I said, you're like our go-to person when it comes to talking about women's health, and in particular, menopause we've brought up a few times. But before we get into the nuts and bolts of the episode, let's talk about how you are since we had our last chat together. So what's been going on, Dr. Sian?
Exciting changes for me. Because of the amount of demand for appointments, women are in such need to be able to have a long conversation about themselves and what their health is doing and how getting someone to pull it all together for them, that I have decided to extend the practice times and give up general practice. I've been a GP in the area for 30 years. OMG. Wow. And it's been a pretty emotional transition, as you can imagine. It's, you become friend and almost family to patients that you've known for that long. But it's exciting for me to be able to spend more days helping women with their hormonal and health concerns. So from the last week of November onwards, the clinic will be open 3 days a week. And then depending on demand, may even increase from there. But we'll see. We'll see. Work-life balance is what it's all about at this stage.
Yeah, well, that's right. And you're talking like this is another big transition. And as we know, midlife is just absolutely chock full of them. So you're sort of looking about how your professional life is going to look going forward. And so, you've made that choice. You've made the choice that GP, the general practice, is just too much, and you want to specialize in the things that you love more.
Yeah, well, it's my time of life to do just this. I've really enjoyed general practice, but trying to do the two roles was proving to be difficult. And to give the best service I can to the women that I'm seeing, it seemed to make sense to step away from general practice and just do the clinic for the women for as long as I can.
Yeah, and I think, Sian, too, you had talked about last time when you were on the podcast about another issue that you had with your shoulder, a frozen shoulder. Has that improved? Oh, for those of you who can't see Sian, she's got her hands above her head now.
It's unfrozen, but I was surprised at how much strength I had on that. In fact, not just my arm, but my left leg, because you favor your other side so completely when you've got something that's not working. And it's back to the gym with me, and it's been an interesting journey getting back into fitness and pain-free sleeping. But to all of those out there of your audience who are suffering with a frozen shoulder, it does unfreeze and you can get back to function. So hang in there. It does.
Yeah. Sure, that's a lot. And when you were talking about it, I've just thought about it then, because I was thinking, well, there's something else I have to ask you. You were talking about how you'll have some 3 days in the clinic. So for those listeners who are, maybe exploring, they don't have a women's health GP close by to them. Does that free up time for more telehealth that you have or that you can offer to women?
Well, yes. I mean, it will give an extra full day of appointments. But telehealth, yes, I do offer telehealth appointments to women, and I've had women who've approached me from quite far and wide. I'm quite happy to accommodate that. But you can't book online. You have to book an online appointment and then send me a message and ask if you can have a telehealth appointment instead of a face-to-face. But there are differences with how Medicare rebates you with telehealth appointments. It's not straightforward. So,
of course, it's not straightforward.
Never straightforward with Medicare.
Oh, dealing with government bureaucracy, who would have thought that wouldn't be straightforward?
Who'd have thought? Anyway, onwards we go. And yeah, it's just allowing more time and more access for as long as women are still a GP to just spend more time with, and one who's got interest enough to answer the questions. And if I can't answer them straight away, I find the answer as best I can. And just an aside, there is a forum for doctors, mainly doctors, who are working in menopause, set up by Kerry Cashel, and we can talk to each other and ask advice from each other. If I've got this patient with this, I don't know how to proceed, and you get this kind of brains trust who come in and help you find the answer, or
great.
To have a look at. And so that's a really good resource for any GP who's interested in menopause matters, and they can get some support from the community that way, which has been great for me as a sole practitioner in this area.
Yes. Yeah. Well, you've got a lot to look forward to then towards the end of the year and what 2026 is going to bring. Yeah,
2026. Yes. Gosh, that's just around the corner.
It's not far away at all. It's just
Thanks for that.
Yeah, you're welcome. You're welcome. I think somebody had a post the other day about 90 days or less than 90 days to the end of the year, and you go, that will go in a heartbeat. Anyway.
Anyway.
Yes. And before we hit record, you were also talking about you're heading away for a couple of weeks just to have a fun trip away.
Going to Japan for 2 weeks, going to meet one of my daughters over there and her partner. So I've never been to Japan, so I'm very lucky to be out there exploring it, and we'll see. I have no idea what to expect, apart from lots of Japan.
Oh, I'm sure you're going to have lots of fun. That'll be great. All right, so let's get stuck into the episode. And we're going to be talking about something that I notice when the word menopause comes up, because there has been so much noise around perimenopause. Your social media feeds are often full of it. It's on the news. It's on current affairs. There's books everywhere that you can see all about it. And a lot of women who have gone through perimenopause and they're now postmenopausal, they think, that's it, done, dusted, wipe my hands of it. It's got nothing to do with me anymore. I've reached that. I don't need to know anything more about it. That may be true with the lead up stage to when you reach menopause, but there's a lot more, as you and I know, to what you start to need to be more aware of once you have reached that stage of no more periods, because for that time onwards, you're in menopause for the rest of your life and your health needs change. So let's talk about that more and what you see with the women coming through your doors, as well as, what you know with your own professional experience and everything that you study about this area.
Yeah, I think it is important that women realise that the worst symptoms we seem to have are when we're perimenopausal. And that's just that time before we have our last ovulation. We have to say that rather than last period, because some women have had hysterectomies or ablations, or they've got a Mirena, so they're not actually bleeding. So to say last period sort of, is difficult for women who don't actually have periods. So it's our final ovulation, and then what happens? So final ovulation puts us into menopause. So menopause is then the phase of life until we shuffle off this mortal coil. So postmenopause sort of makes us feel like or think that it's over. Well, postmenopause means, menopause is finished. Well, ovulation is finished, but you're still in menopause with low hormone levels, and that carries on forever unless you're taking hormone supplements. So in that time after our final ovulation, and as we age, we have a couple of things that change for us that we didn't experience when we're younger and still have lots of estrogen and floating around. The main one we all know about is that we start losing more bone. Our bone loss accelerates. So we have a gradual fall of our bone strength over time just by aging. From our peak bone mass, which we have laid down in adolescence and our early 20s, when hopefully we've been very fit and active and had a good diet. So we have our peak bone mass that starts to fall as we age and then kind of falls off a cliff in women because we lose our estrogen. Our estrogen helps us build and maintain bone. So that will continue for as long as we live. So if you can imagine, if we don't have any estrogen on top of, you know, the usual things that we need to do with exercise and diet, then our bones will rapidly thin into that more dangerous level where we're at a higher risk of having a fracture. So that's probably one of the main things. But I don't want women to feel like there's nothing they can do but take estrogen. It's really important that we have good calcium in our diet, that we have good vitamin D, so some sunlight, and if we're sun avoidant because of skin cancers or photosensitive skin, then taking a supplement and doing the right sort of exercise. Well, what's the right sort of exercise? One, any. If you've not been moving, time to get off the couch and move, and then progressively increase what you can do so that you can safely strengthen your bones using weight-bearing exercise. And that's important to understand so you don't injure yourself like I did. I think I mentioned in one of the podcasts before, I decided I was going to start skipping and then did something to my knee. So we've got to strengthen condition before we can do weight-bearing exercise. So, you know, that's one of the things that continues after our last period that has nothing to do with hot flushes, night sweats, you know, joint pains and all the other things that we experience in perimenopause. So, you know, that's one of the things we have to remember in our last period, last ovulation zone till we shuffle off. The other one, of course, is our heart health. As we get further into menopause and we don't have the cardioprotective effect of our estrogen, our rates of heart disease goes up. And that's just not heart problems, it's risk of strokes, etc., that increases as we get further from that last ovulation. So important for that is good diet, good cholesterol levels, exercise, again, you know, majorly important. But we do know that if we have estrogen replaced or in that first 10 years from the final ovulation, then that can be heart protective and can actually help prevent female heart disease. Yeah, am I making sense so far?
Yeah, absolutely. I'm just hanging on, nodding my head, because obviously you can't. Listeners won't be able to hear my head nod. Well, I hope they can't. But they, yes, I'm listening intently. I'm listening intently. Yeah.
Bones.
Heart.
And the other thing, of course, is to remember is our genital urinary area. Yeah. So the longer we go without estrogen, the more our tissues in our vagina and vulva start to shrink. The tissues get firmer, less lubricated, and we lose the barrier in our urethra to bacteria. So we get, you know, we can have more painful, less enjoyable sex, but also more as well from health point of view, more importantly, is that we get increased urinary tract infections, remembering that urinary tract infections can actually be deadly because they can get to our kidneys and cause septicemia. So those are the sorts of things that can happen as we age. We know that women who exercise are less likely to get dementia, all forms of dementia, but obviously there's a vascular dementia. So if we improve our vascular system, we're going to reduce our rate of dementia as well. So all of these things are health things that happen after our final ovulation. So it's not over until, we finally pass away. So we have to try and keep as healthy as we can after that final ovulation, even if we are experiencing no hot flushes, night sweats, insomnia. If we're feeling well and mentally and physically, these things are sort of coming along in the background without us really noticing if we're not careful.
Well, that's right, because all of a sudden another year passes, suddenly it's a decade and you're further down the track and your health may not be as good as what it could and should be. So I think, that the whole taking ownership of your health, being the CEO of your health, making sure that you are on top of all of your health checks, that you're making sure that you're, as I talk about when we do our events together, our pillars of our wellness, to make sure that we're looking at all of those various areas that you mentioned, our nutrition, our movement, how well we're sleeping, and just to try to fine tune that. And it'll change as our needs change. Like all of a sudden, yes, you do. I've got a dicky shoulder now, so you had your turn, and so I've got, I've been battling a shoulder. So all of a sudden, you've got to morph and change and do things slightly differently. So our needs are going to change, and therefore, what we do is going to have to change. But it doesn't mean the word is change. It doesn't mean it stops. And I think that's really important. That our periods may have stopped if you're lucky enough. I've had an ablation now. I think I'm about 170 days now without having a bleed, which is just extraordinary. I'm beside myself.
Very freeing.
Yeah.
Very liberating.
Yeah, liberating. That's it. And I know I am still cycling because I can feel, feel the other effects of it. But just not having that bleed is wonderful. So women, just to be reassured that now is the time to look after our 40s, 50s, 60s and beyond. We really have to be very mindful.
Have to be very aware of what we need to manage for our own health. So, often I will, see women who have come in for help and advice with their perimenopause, early menopause symptoms. So, and we, if they choose to take hormone therapy, we adjust the doses, get them set, and then I will, it's almost like a graduation ceremony. I say, well, you can go back to your GP now because this dose works for you, you're feeling well. However, I want you to remember to stay on top of these things. You need to be an advocate for this. Don't rely on your GP to remember to tick all the boxes for you. You need to be able to say, these are the things I want done and these are the tests I need to do. Because, it's your body. It's like your car. You wouldn't just drop it off at the mechanics. You'd want to know what they were changing and checking and doing because you're going to be driving in it and you want to make sure you're safe on the highway. So, it's the same with your body. You've got to stop and know.
The analogy sometimes, we're so mindful of making sure that our phones, the batteries are plugged in so our phone doesn't run flat, that we update the apps, that we've got the latest system running on all of our computers and whatnot. But we don't apply that the same to ourselves, just to make sure we plug in the battery, we check, we update, we do all the things that we need to so we're running well.
Exactly. Especially, I think, men find it difficult to be health conscious for their own reasons, but we're just talking about women here, is that often our needs come very low to the stack. It's always about, the family first, children first, the dog, the cat, they all get to the vets and the dentist, but we often don't, do the same for ourselves. So, it's always something I say to women is that you've got to put, like the aircraft, put your own oxygen on first, make sure you're okay and everyone else will follow. We can't have you not being able to be well as you possibly can be, self, but also for your community, your family first. So we have to educate ourselves, like what tests do we need, what do we need to keep an eye on. So mainly it's You know, we need to keep an eye on our heart, our bones, our breasts if we still got them, and you know, and our brains. These are really important, and our genital urinary areas. We've got to make sure we're aware of what isn't, what we can do about it.
And we do have a number of episodes where we've dug a lot deeper into those areas. So if you are a listener, a newer listener, and you don't have the back catalogue, on episode 119, Dr. Sian and I talked about heart health, weight gain, and hormones in more depth. And in episode 130, we looked at one on talked about sex and GSM in depth. So they're two episodes I can highly recommend you go back to and listen. And even if you have listened and something that Dr. Sian's just said has triggered your thought processes, and you go, oh God, what was that all about again? Head back, and because these are resources that you can go over and listen to again and again. And the bone health one, there is a great one that I have done with Professor Belinda Beck, and I don't know off the top of my head the actual number of that, but I'm sure you just scroll through and you'll find it. And that's a really beneficial one to listen to as well. So let's talk about something else now that women need support with. And you mentioned the word a little bit more on was that whole look, get my mouthful around it now, advocacy, and how to be an advocate for yourself when you go and visit a doctor. And it may not be somebody who's all that up to date with women's health. And I'm thinking, and there's lots of women who have a male GP, and they might feel a little bit uncomfortable about talking to a man about certain parts of on what's happening to them. They may feel they've gone before, and they may or may not have been dismissed. I know a lot of women who live in rural and remote parts of Australia. They don't have access to female GPs as well, or gynecologists who may be females. So how do you suggest women start to talk about these sorts of symptoms that they might experience or problems that they might have that they want to share with the doctor, but they're not quite sure how to go about it? What do you suggest for them, Sian?
GPs can use a half-hour appointment now. There is a special item number that can be used, so the patient gets a higher rebate back from Medicare. So you can, you have to book a half-hour appointment that is solely for your women's health concerns, not tacked on to a time when you've got a cold or, a sprained ankle. It has to be a dedicated appointment for that conversation. Most practices now have websites, so you can look at your GP's profile, but also maybe a GP in that practice who may have a special interest in women's health, and that you can ask the receptionist if it's possible to book in with that GP, even if they're not your primary GP, to cover the male-female difficulty and embarrassment effect. Looking at the Australasian Menopause Society website, they have a list of GPs who are members, and you might be able to find someone in your area who has a special interest in women's health, because you can go and see a different GP. You're not tied into one doctor. We do want to have a special relationship with our GP because we want to have all of our health records as much as possible in the one place. It's just safe for that continuity of care, so everybody knows the whole you. That holistic care is really important. But you can, if you're not feeling that your GP has the interest or expertise in this area, if you feel like they're not listening or they're giving you information that you feel may not be completely up to date, you can find another GP, but always ask them if it's possible to share that information that you've discussed with them. Say, for instance, in my practice, I send the patient an email summary of what we've discussed and what we've planned, and I advise them to share that with their GP at their next consultation. And I always copy in the woman's GP to any tests that we do, like a bone density or anything. So all the information's on their central records. So I think what women need to know is that they can ask someone else. If you're not the answers, ask someone else, find someone else to talk to. You can always link back into your GP as well. And hopefully doctors will be secure enough to understand that people need to get information from other sources. Sometimes, it's a bit like people can feel like they're cheating on their doctor if they go and see another GP with a special interest. And sometimes GPs do feel like they've been cheated on if they go to another GP. But, we all have our areas of interest. So we should respect that and respect that our patients, are well within their rights to ask for other opinions from other GPs if they need to.
Yes.
So that's the main ways of being an advocate for yourself, is to not feel intimidated and ask someone else, or ask again if you feel like you need to.
And it is so very important to have these conversations. And when you do talk to your doctor, not to leave it right to the end of the appointment. And, oh, by the way, and that window's then closed. That's another thing that I know of. A friend and I were laughing about it the other day, about how she mentioned something to a doctor just as she was almost leaving the room. And that's not the time to bring up something.
Ask for a dedicated half-hour appointment just to talk about your hormone concerns, and then the GP will know that's what you're there for and will be able to give you their full attention just on that subject. So don't ask for a referral to a physio and an x-ray for your sore foot, and then and by the way, I'm having hot flushes and night sweats. It takes a long time to really dig deep into what a woman needs. I allow an hour because I just find that half an hour tends to feel more like a ticker box rather than really digging deep into the complexity of what women's lives are. And we do lead very complex lives with our family commitments, relationship, parental assistance, careers. So I very rarely find I take less than an hour to really dig deep into.
Yeah. So I'll put the link to the Menopause Society in the show notes as well. So there's that link of doctors who've got a special interest in. So if you feel as though that you may not be comfortable talking to your own doctor, or it's not the answers that you are after, then go to the show notes, listeners, and you can find that link there. And just touching on something that you just mentioned then, it is October is World Menopause Awareness Month, and it highlighted that menopause is just one of the many transitions that women go through. And that's what this podcast is all about, as well as talking about menopause being an incredibly important transition and one that we need to know more about, but also it's talking about the other incredible amount of transitions that we go through. And that's where that longer length of time is a great awareness for your doctor who wouldn't be, who would not even have that on his or her horizon on what you might be going through in other areas in order to help you.
Exactly. As I always feel like, before we hit perimenopause, women's brains have this lovely, estrogen sort of blanket. So it makes us all powerful, all seeing beings. And then when it starts to fade, it's like the blanket comes off and all this it's underneath, and which so happens to hit the same time as, kids enter adolescence and parents start to, need more health needs as well. And women's resilience and their ability to spin all these different things in their lives seems to disappear. And that's very common. I think no matter whether you have night sweats or insomnia or any of the other symptoms that go with it, there's definitely a decrease in our ability and want to multitask and do and be everything to everyone. There's a definite and I see that time and time again. It's like women are saying, I'm exhausted, I'm overwhelmed, I've had enough. You go, okay, let's peel it back. What can you? can you let go of? What can you say no to? What can you do for yourself to build yourself back up?
Yes.
And it's with those very basic things like eating well, sleeping well, exercising, spending time alone, connecting with friends and activities that spark joy, letting go of the things that don't so much.
That's it. And that's why our event that we had together and continue to have, they're so important, because we're looking at that. It's not the same for everybody. There is no one size fits all. Everyone's life is so very, very different. Everyone's experience of each transition that happens during this stage is very different. And menopause is also very different and very individual. So combining all of those is, we've just got to have that awareness, I think, for women to know what could be ahead for them, that things will change. Yeah. And that along that change will be a degree of, like it's a continuum. Some transitions will slip through without many hiccups at all, whereas others can be just like a tidal wave coming at you. And then you may have a couple hitting you all at once, which is lots of fun too.
Yes, yeah. Yes. And it's knowing where do I begin? What do I do with? And I know, part of your presentation is about, small habits, starting small, not trying to think too big. You can't fix everything all at once. So, it's I sort of use the term Build-A-Bear to women, let's build from the ground up. How are we going to do this? What can we do first that's going to be helpful? And and I think that's a lot of what the overwhelm feels with women, is that they feel like, number one, they shouldn't be feeling like this. So it's recognizing and giving them permission to say, yeah, no, you are feeling terrible and this is real and you do want to make some changes, and that's okay. Yeah. And then, and then finding, and that's what we do in our presentations, isn't it? We have a safe space, so small numbers of women who can, talk to each other freely. They know that they're in a place where it's confidential, and they can feel at ease with other women and feel that they can share their stories and ask the questions to ask. Yeah.
The great thing about having conversations, and when women get together in events like we do host, is that they realize that they're not alone. It can feel really isolating sometimes, that you're the only one. You feel like you're the only one going through things, and you don't want to mention it because you don't want to load somebody else up with your issues and your problems, or you don't think the problems are big enough. Yet, if you're feeling that way, it's big enough. And I think that was a lovely thing about the event, is that women could see that they weren't in isolation, that it may look slightly different, but there were so many commonalities. And the connection that women get when they can talk openly, talk freely, that's something special. That really is special.
Absolutely. There is, it is the sisterhood.
Yes.
And it does help to share information as well. What has helped you, who has helped you, what are you finding works, what doesn't work. It's really important. So I think, hopefully the word will spread and we'll be able to run more of these events. We're looking at taking some out into our more rural areas, aren't we, Jo? So we can meet more women, especially those who are more isolated and don't have access to, usually have access to these sorts of events, which will be good to be able to do that.
Yeah, it is. And it's so lovely to have a time just to focus on you, because it's rare that a woman can sit and go away somewhere and just devote some time to themselves, to learn more about what is happening to them, to learn how they can support themselves best. Because when we support ourselves best, we help others. The ripple effect is incredible. It's hard to measure, but just seeing this time of being that you can allocate for yourself as your own self-development.
Exactly. Yeah. And it's a beautiful setting where we are holding it again at Noosa Springs, and overlooking the golf course, and like lunch and time afterwards to chat and socialize if you wish to. So no, I thoroughly enjoyed our last event, and I know I will this one as well.
Yeah,
so.
It was great fun. We got the feedback, and this is I wrote down some of the things so I wouldn't forget. Is that the women who the feedback that we got was they'd love it to be a bit longer. So we've made this event longer as well, so we can get more in depth, more conversation, more time to think, more time to plan and workshop some of the things that we're talking about. But over and over, when we got the feedback forms, they said that they felt more confident, more motivated, more energized, and more curious about this next stage of life. But out of all of those things, what was absolutely overwhelming, every single one of them said that they felt more supported and that they would recommend the event to another woman. So that's as event coordinators for you and I, that was great feedback. That's what we were after, and that's what we want to keep on encouraging women to come along to these events so that they've got a chance to have that, to learn more about what's happening to them and to see what they can do to support themselves through this next stage.
Exactly. It's very important for women, and there is a lot of information and a lot of noise and on the internet and social media, and it is allowing women to go, okay, well, what does it actually mean, and ask those questions of us when we're there, and say, do we have to do this? All these good information, but also some misinformation as well, and it can be overwhelming, and it's very hard to pick apart when you're busy with your work and your family, to think, to sit down and really research things. So hopefully we help women navigate that space too.
Yes, well, certainly I know with the women from our last event that was the case, and I really hope for the next event that's coming up on the 8th of November at Noosa Springs, like you said, and that's, I think I've written down from about 8:45, so we can start at 9. And we've got all the refreshments, all of the morning tea and afternoon teas and the lunches, everything's there. All you need to do is just obviously buy a ticket and enjoy.
Buy a ticket, bring a friend.
Bring a friend. And that's the other thing. The women who did bring a friend along, that was great for them too, because then they can leave and continue on the conversations.
Exactly. Really important. Yeah.
So we would love to see anybody who is in this area, this part of the world, and even if you're not, it's on a weekend, so it's a Saturday, make a trip of it. Come on up and give yourself this time. And there's lots of beautiful things to see and do and around the Noosa area, the Sunshine Coast area here in Queensland. So if you do want to come along, the link to get a ticket is in the show notes. It's also on my Instagram page. I have a link there for you. And you can also get a direct link from my website joclarkcoaching.com. So just in closing, Sian, is there anything else that you would like to say before we wrap up today's little conversation together?
Well, as we're coming into the hotter months, if you're feeling that you can no longer bear your hot flushes and night sweats, whether you want to take hormones or not, there are medications and things that you can do to help. So go along and see your GP, or come along and make an appointment to see myself, and we'll help you through the sweaty months in Queensland and beyond in Australia. But I just want women to feel the best that they can, and to keep having those conversations, keep asking the questions of their doctors. Don't allow your doctor to gatekeep you with phrases like you're too young, or you're too old, or this isn't right for you. Ask why, and keep asking those questions of health professionals.
Yes. And whether or not you have symptoms or not, whether you are peri or whether you have reached menopause, the thing is your health needs have changed. And therefore we need to start being proactive, because everybody wants to live a long life, but we want to live well into those latter years. And it starts now. So we really have to make sure that we focus on that.
It's never too late. I have been seeing women who are well into their 60s and some 70s who are, what can I do now? I did miss out because there was all care going on, and it's definitely worth having a conversation about your bones and your heart, and making sure that you are doing the best that you can for your health, no matter what your age.
Yes, exactly. And see what checks you do need to have done. What tests is really important. I know with the ladies in my Better Than Before membership, last week we had, or the week might have been the week before now, we planned our last quarter. What was that going to look like? How were our goals looking? And what health checks are on our list of things to do that we haven't done yet, and make sure it goes on your calendar. So that's, it's really important that you become proactive.
Yes, exactly. Because not all of those health checks are necessarily, funded by Medicare. So may not be presented to you as being one that you can access. Things like bone density, the government only gives you a rebate when you turn 70. It's a bit late then. It's quite surprising, quite horrifying how many women in their 50s are very close to osteoporosis. So if they waited another 20 years before they got a bone density, you could see how they'd be in a lot of problems if they hadn't already had a significant fracture by then. So, bones, heart checks, these are all important, but may not be offered to you as a routine GP visit. So that's where you need to speak up and ask for these tests. And if you have the means, pay for them. Unfortunately, if you don't have the means, it's really tricky to get access to these tests.
Yes. And I know Gene House Women's Health, they also have a little, they've changed it slightly. I think they've got a PDF as well, but they've also got like almost a quiz that they put together for Women's Health Month, which was there last month. I think they were really focusing on that, or Women's Health Week last month in September. So if you go onto their website, they've also got an up-to-date, depending on how your age, your ethnicity and so forth, they can give you an idea of what you might need to book in before the year is out. Yes. Like you said, it is never too late, and that is the best message of all.
Never too late.
Never too late. Well, Sian, you have an absolutely wonderful time over in Japan. I can't wait to hear and see all of the photos and hear your stories about what you've done over there. It'll be great.
Lots of train trips, so it'll be good.
Quick train trips.
Yeah, be exciting. Thank you very much. All the best to you too. Thanks Pleasure. For organising again.
All righty. Lots of love. Okay. See you, Sian. Bye.
Bye.
Thanks so much for spending your time with me today. I hope you feel inspired to make the next chapter of your life the best one yet. And remember to share this episode with someone else who would love it, and connect with me on Instagram or LinkedIn at Jo Clark Coaching. All the links and the details from today's episode are in the show notes or at joclarkcoaching.com. And if you enjoyed this episode, please follow or subscribe this show on your favourite podcast app and leave a 5-star rating and review. This helps more midlife women find these empowering conversations. I can't wait to chat with you next week. Until then, take care and keep creating a life that you love.